Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. On October the 5th, 2016, Medscape published an interview with a leading cardiologist from the UK named Dr. Aseem Malhotra. Now, the topic was how best to prevent heart attack, stroke, and vascular disease. These are leading causes of death and compromised quality of life in our modern society, as you know. So Dr. Malhotra notes that he spent many years of his life reviewing all the literature and data on cardiovascular disease, and he indicates that dietary changes can rapidly reduce cardiovascular disease risk. So he further states that clinical studies actually show that after a heart attack, prudent dietary changes are more effective than cholesterol-lowering statin drugs in preventing future death from heart attack and related cardiovascular events. It's not that cholesterol-lowering drugs are not important, it's that they're overprescribed and very often little attention is given to diet and lifestyle, and that's a huge mistake in his view. So with respect to diet, the original work on diet and heart disease was done by Dr. Ancel Keys. He's a researcher dating back to the 1950s. So Dr. Keys originally visited Piopi, a little hamlet in Italy, sort of on the Mediterranean Sea. And he went there every 6 months for 30 consecutive years, looking at why the residents of this little hamlet in Italy enjoyed extraordinary health and longevity with documented very low rates of heart disease and stroke. The average lifespan in Piopi dating back to the 1950s was around 90 years old, that was a remarkable back in the 1950s to see, a population living to be 90 plus was quite extraordinary. So Ancel Keys was the first to note that high blood levels of cholesterol were a major risk factor for heart disease, as he published in the famous 7-country study, and I believe he published that sometime in the 1960s. He also noted that the original Mediterranean diet seemed to afford the people of Piopi, Italy, protection against heart disease and other degenerative diseases, including cancer. But as Dr. Malhotra indicates, the Mediterranean diet of today is quite different from the Mediterranean diet of 50 to 70 years ago, when Dr. Ancel Keys first stumbled across this important link between the Mediterranean diet and disease protection. So Dr. Malhotra is a big fan of the original Mediterranean diet, which features only a small serving of pasta as a meal starter if you're going to have it at all. Not as a main course, not pasta as the main course. That's a mistake. The foods that should comprise the bulk of the diet are green, leafy vegetables and various cruciferous vegetables like broccoli, cauliflower, cabbage, also tomatoes and other non-starchy carbohydrates that are loaded with protective nutrients, a lot of vegetables and some fruits. Other features of the diet should include nuts and beans and peas, extra virgin olive oil, and fatty fish. These foods not only help to keep cholesterol down, but they also are proven to reduce blood vessel inflammation. So he makes the point that it's inflammation in the blood vessel wall that leads to plaque rupture and the clumping together of platelets that form the final event triggering a heart attack or a stroke. So a major function of diet, your diet, should be to reduce blood vessel inflammation, and the main way to do that is to lower your intake of refined sugars and too many starchy carbohydrate foods like bread, pasta, and potatoes. As he points out, right now about 40% of the U.S. population are pre-diabetics, and that's mostly due to over-consuming refined sugars, too many starchy carbs, as well as some of the bad fats and not enough physical activity. And he notes that the drugs that are used to control blood sugar today, used by diabetics and pre-diabetics that lower blood sugar, the studies show that they don't actually reduce risk of heart attack, stroke, and sort of death from all causes. The thing to point out here is that diabetics primarily die from heart attacks. So these glucose or blood sugar lowering drugs, although they lower blood sugar, are not preventing death from the complications of diabetes to a significant degree. So a recent study did show that one of the blood sugar lowering drugs did lower cardiovascular deaths in a group of type 2 diabetics, but those findings need to be confirmed in future studies. Now, the other way to reduce inflammation in the blood vessel wall is to eat the anti-inflammatory foods that I mentioned, but also by not smoking. And the people of POP also spend more time outside walking around, so they get more physical activity. They have higher blood levels of vitamin D from sunshine exposure. So both of these factors, being physically active and having more vitamin D, are probably linked to their better longevity statistics and their impressive disease-free health statistics overall. You know, sitting is the new smoking, as they say. So if you have a desk job Dr. Malhotra recommends that you get up every 45 minutes and walk around. Even if you're already exercising in the gym or on home exercise equipment, the idea is to try to move more throughout the day. And the people of POP are also living in a lower stress environment. He notes that it's very difficult to specifically measure stress, but we know it's a big problem. People who have chronic stress from a young age, where there's been a childhood trauma, have an average life expectancy that's 20 years less than other people. So anything that de-stresses you will likely reduce your risk of heart disease, whether it's yoga, deep breathing, aerobic exercise, meditation, whatever works for you. Now, when speaking to his own heart disease patients, Dr. Malhotra states that he explains the benefits of the drugs that he's prescribing. And then in quotes he says, "But what's really important is that you make the recommended lifestyle changes," the changes that we're talking about in the article here. So I've provided a link to the interview on Medscape for you to review if you want to see it. It's in the text below. So I hope you'll take advantage or take this advice to heart and keep moving towards a healthier heart lifestyle program yourself. So thanks very much for watching. I'll see you next time.